We have spoken before about how healthcare costs can evaporate retirement savings without proper planning, and that's why it's important to carefully manage Medicare benefits. And a big part of that is the program's annual election period, which we've spoken of, is coming up in just a couple weeks, October 15th through December 7th. So let's talk about this. What are the mistakes, the Medicare mistakes people make during the annual election period?
Well, Medicare's open enrollment period starts October 15th and runs through December 7th. This is your chance to make a change to your current plan, to go over what's new and changed for Medicare for that upcoming year. December 7th is the drop dead date for the annual enrollment period. At that point, that's when you want to make a change to your plan. The surprising numbers are the people that actually are okay with their plan. They don't feel they have a need to make a change. Nothing changed in my health from last year to go into this year. So they really don't do anything. They're not proactive in making sure that their plan is going to be best for them in that year to come. Despite the fact that, the decisions have to be made, they know that their plan will automatically roll over, and they really don't do anything at all. So I want to go through 10 of the top common mistakes that most people make in the annual enrollment period, or the lack of participating in the annual enrollment period. The first one is not reviewing their current plan. It's shocking to me the number of people that don't actually go out and are proactive in reviewing their current plan. Everybody that is on a Medicare Advantage plan or a prescription drug plan will receive what's called an ANOC. It's an annual notice of change. In that annual notice of change, it goes through the current benefits and the changings of that plan for the next year. A lot of people get this. It's a big binder. They are a big, like a magazine type mailer that they receive, and a lot of people don't even look at it. Nothing's changed in my health. I'm just going to move on. So, not looking at that and going through the changes is one big mistake that a lot of people just fail to consider what's changing. Looking at premiums, copays, deductibles, and drug formularies is a huge one. A lot of people don't realize that these change every year. And if you're not reviewing your plan, you're not going to realize or know that those things have changed. Forgetting to check the actual prescription drug coverage. Part D prescription drug plans change every year. And if your prescriptions are the same, then you may assume that things are going to be the same for next year. That's not the case. Every year, these prescription drug plans change. Not comparing your current plan with other plans available to you is a big mistake that I see a lot of people come across. A lot of people don't have an advisor, and if you don't have an advisor, that means you most likely purchase your plan directly from the company. And I ask this question when I do my events all the time. If you don't have an advisor, if you purchase your plan directly from the company, do you think that company is going to tell you what's new and changing for other plans? It's not in their best interest to do so. You're only going to see what your plan's benefits are and what's changing for your plans. That's the importance of an advisor. If you go out on our website, americasmedicareassociates.com, we have videos out there explaining the importance and why an advisor is important to you. I would invite you to check that out to kind of see how that's going to impact you. Assuming cheapest premium is the best plan. I run into this all the time. Low premiums do not equate to low out-of-pocket costs. This is something that a lot of people are misunderstanding. Cheapest is not always the best. The right plan depends on total healthcare usage and not premium cost. This is exactly what I'm talking about. It depends on what you're using versus what you're paying. That's why you need to do a review. Not checking provider network. This is another big one. The networks, let's say your doctor retired and you need a new doctor. The new doctor may not take the same plan that your old doctor was taking. Okay, so it's important to verify and validate the network. The doctors, the hospitals, and the facilities that you go to are still in network. Specialists, these are important for you. We don't want you to change your doctors or your facilities or your specialists. They know you, they know your history. So not checking the network is another big one. Overlooking extra benefits. I run into this almost daily. I didn't realize I had the over-the-counter. I didn't know my dental coverage was that much. Did I have vision? I never knew that. You've got these benefits. If you're on an Advantage plan, these come with the plan. A gym membership. Well, I've been paying for silver sneakers all along. I didn't know it was free with my plan. So take the time to make sure that you find out what your extra benefits are and how you can benefit from using them. One of them is the PERS device, the Personal Emergency Response System. If you're an individual living by yourself, have a multi-story home, and you should definitely seek out this device. It's typically free with most plans out there, and it's one of the devices that are it reports to EMS for you if you fall and you're not able to get to the phone. This device is available to you automatically. Missing the enrollment window. I mentioned the enrollment window is October 15th through December 7th. If you miss that window, then you could be stuck with the plan that you have. There is one more chance for those that are on an Advantage plan, and that is the open enrollment from January 1st through March 31st. But if you miss the annual enrollment window, you could be stuck on your current plan. Number 7, not considering the total health care costs. Well, what do I mean by that? It's very simple. Your out-of-pocket costs, you have a threshold, a stop loss, the maximum amount that you would ever pay in any one year. If you don't take into account that you've got co-pays, deductibles, prescription co-pays, prescription max out-of-pocket, these can be very, very costly and blow up a retirement plan. I had a client that actually changed a plan, went from a $3,400 max out-of-pocket to a $9,350 max out-of-pocket, all because she was misinformed by someone misleading her. $9,000 out of pocket could blow up your savings. Failing to consider changing health needs. This is another one where a lot of people don't take into account what their actual needs are. Do you really need some of the benefits that you are trying to prepare against and fight against? Relying solely on friends and family for advice. This one here brings a smile on my face. I do a lot of events, and it's kind of funny to me, and I go through when I do my events, and I ask people, how many of you have been told by a family member or a friend that you need to do this or you will be penalized, or my plan is this and it's the best? I run into that a lot. The unfortunate thing is a lot of people mean well, but they don't do this on a day-to-day basis like an advisor like myself or other advisors that do things like me. It's important to make sure that you understand that your plan is an individualized plan. What works for your neighbor or your brother or your sister doesn't necessarily work best for you. And the last thing I'll mention, which I've already talked about a little bit, is not seeking professional guidance. One thing to make sure you understand is if you come to us here at America's Medicare Associates, we do not charge a fee. We never have. We are here to help you understand what your plan benefits are. We do educational events to hopefully give you information to entice you to come in because you want to learn more about your particular situation. How can we help you? This is very, very important to us, and that's why we do what we do. We've been doing it for a long time, and helping seniors navigate through their annual enrollment period and their plan. A lot of times, the plan you're on may be the best plan for you, and I'll tell you straight up, keep what you've got. It's the best plan for you. Let's make sure that you utilize the benefits correctly. So these are the top 10 reasons that people make major mistakes that can be very costly to them during the annual enrollment period. Don't be one of those people that run into these issues and miss out on getting the new information for 26. I will tell you this, 2026, there are major changes in the healthcare arena, and you need to make sure that you're on top of it. We are having some events coming up. We do educational events. I know in 2 weeks we'll be at the Red Lobster in Monroe Street. If you would like information or would like to register for one of those events, it's on Tuesday the 7th and Thursday the 9th. You can register on America's Medicare Associates.com website. There's a link you can click to sign up for our events. And there's no obligation to buy anything, but it's an opportunity for you to get more information about your needs and your benefits.